cholesterol is a molecule that is actually very important in our body, and it aids in many production of many hormones and membranes. However, high cholesterol convey high cardiovascular risk for, be it for myocardial infarction, so heart attack, stroke, or peripheral artery disease. So having high cholesterol is, to put it simple, not good for you. And men are especially at higher risk for cardiovascular than compared to women. Therefore, we start the screening around 35 to 40 for men to start screening the lipid level. And of course, if there are any conditions that would put them on higher risk, like hypertension, diabetes, obesity, or whatnot, then we would start the screening much, much earlier. And the screening means that basically you get your blood levels checked, probably at a GP level or with us endocrinologists, and that blood test will typically contain the total cholesterol level, then the bad cholesterol, which is the LDL cholesterol, and the HDL cholesterol, which is known as the good cholesterol. And we also measure the triglyceride levels, which are not related to cholesterol, and that is what we call the lipid panel. No, absolutely not. So cholesterol is really essential. It's just that high cholesterol levels are dangerous because the lipids then are being accumulated in the walls of your vessels that subsequently can cause you to have heart attack or stroke. So that is the downside of high cholesterol. Yeah, so especially if the lipid levels, if the LDL levels are very high, and we want to clarify the risk, especially in a person who does not have any history of heart attack or stroke, which we then call the primary prevention situation. We then want to clarify the risk, the cardiovascular risk, some more. Or in persons who already have high risk, the measurement of lipoprotein A helps us to clarify how high the cardiovascular risk is, because lipoprotein A is an independent factor for cardiovascular risk. So you will have the high cholesterol levels that you measure in your blood. That will tell you roughly what the risk is, right? So we have special calculators that we put in your previous diseases, whether you're smoking, whether you're drinking, your lifestyle factors. We put in your cholesterol levels, and then the calculator will give you the risk. But lipoprotein A, it's an independent risk factor for cardiovascular health. So meaning that you basically, independent of your cholesterol levels, this level of lipoprotein A will give you a clue how much higher your risk actually is. And the interesting part about the lipoprotein A, that the level is predominantly genetically inherited. What it means that there's little you can do yourself in terms of lifestyle or anything to lower it down. So yeah, absolutely. I mean, the common things are still common. So I think obesity and bad lifestyle choices are still the number one cause of high cholesterol. So not only like fried foods, red meat, and cheese, and are contributed to your cholesterol being high, but of course also alcohol is one of them. But on the other hand, you will have this people who lead healthy lifestyles and still have high cholesterol. And we now know that familial hyperlipidemia is quite more, which is genetical disorder which leads to high cholesterol, is more common than we are aware of. So about 1 in 250 people will have that disorder, and they will have very high LDL cholesterol levels, around 180 and 200, that it can only be lowered through lifestyle factors to some degree. but they will remain high. And those are the people that are really at high risk for cardiovascular disease and need treatment with medications. The heart and the blood vessels, right, for your risk for stroke or even peripheral artery disease. So all the lipids are being stored or accumulated in the walls of the vessels, leading to arteriosclerosis.
And for those that are already there, will diet and lifestyle changes move them along in their journey, or will it just stop more from happening?
It will improve it, definitely. So we know that diet or lifestyle changes or reducing the alcohol intake can reduce the cholesterol level about 20 to 30%. And that will, of course, reflect in the changes on the blood vessel walls as well.
But you're saying alcohol also plays a part in cholesterol. I didn't know that.
Yeah. I guess like it's ends up being a vicious cycle, right? I guess once you get into the bad lifestyle stuff, it's just like a chain reaction, right? I would refer to myself as a common sense endocrinologist. Only the advice that we give and the consultation, the way we interact with our patients is only then valuable if it applies really to their personal life, whether or not in those situations where they go to meals, to gatherings, like there are government officials who have to go to those gatherings, and at those gatherings, you are expected to participate, right? You can't just be sitting there and saying, I can't eat this and that because of this. And so there is a barrier, right, in our society that at social gatherings or dinners or encounters with our friends, which are really important for our mental health, we kind of can't separate ourselves and say, I will go out to dinner with you, but let's just go for a restaurant that has got organic food and who doesn't use saturated fats to fry stuff, and I don't want to eat any fried stuff, and your choices, to be quite frankly honest, will be very, very narrow. So I guess anything I recommend to the patient, it has to apply to their own lives and how they can, with the business and with the structure of their life, how can they still lead a healthy lifestyle that promotes health of the blood vessels and overall health, so that they have energy to do the things they have to do every day, right? You can go to my website and book for a consultation. There, I think that's the best first step to see where you at from a hormonal point of view and from the point of view of your metabolism as well. And then you kind of we will then establish the baseline where you're at from the hormonal point of view, your metabolism, and where you at really in your life. What is your life looking right now, right? What is your what is most important to you? And then we can basically establish the personalized plan for you, and in fact a plan that you can carry on doing after you leave the clinic, because it's like we it's about the year is about to end, right? And then the New Year's always comes with the New Year's resolutions, and we all know that the fitness centers expect every and each year a boom of people signing up, and it's and by April, May, most of people who signed up are only donators. They just donate money for the fitness centers, right? So if it was that easy, like we would not have those problems. Like we would have countries with skinny people who are exercising daily and only making healthy choices. But just life gets in the way, and our desires and our desire to have a community with our friends, family, and have a nice meal. It's such a huge part of our culture as well. And it's sometimes so difficult to break through this, right? To say, okay, I know I'm going to my mom's place and she's obese and she only will cook the unhealthy stuff, but you can't like cancel the appointment and say to her, and this is the list my doctor gave me and I can't eat it. I think most of us would feel that's very disrespectful. So I feel we want to show respect to the people we gather with by saying, okay, I will go and have that meal with you, even though that doesn't, I know this is not what my doctor recommended, because we feel ashamed of saying, like, putting on the hustle for your guests or for the restaurant to say, oh, only olive oil, please. I don't eat any fried food and gluten-free and no refined sugar. And the waitress is standing there and feel like, oh, please do not come back. Like,
Yeah, I think it's like we want to fit in, we want to blend in,
yes.
we don't want to stand out because we're seen then as being difficult, you know?
People are very interested about supplements, and there is actually a supplement that is has been known for a while and has been used in China, which is the red yeast rice supplement or a red yeast extract that you can buy as a tablet. And this has been used in China to lower cholesterol. And the red yeast rice is basically on the red rice, there is a fungus that ferments on the red rice, and that's why the rice gets red. And that fungus contains a substance called monacolin K, which has got very similar working mechanism that the medication that we use actually to lower the cholesterol, commonly called statins. So that mushroom, that fungus, basically works very similar to those drugs, same working mechanism. So the statin drugs that we use to treat cholesterol that you probably have heard of, as like simvastatin or atorvastatin, rosuvastatin, plenty of them, they're really good, very effective drugs to lower your cardiovascular risk. But many people assume, because the side effect, the most commonly known side effect of those drugs are myalgias, which is muscle pains or fatigue. So many patients say, oh, I don't want to take those drugs, I will just take the supplement. So they buy the red yeast rice extract as a tablet, not knowing, thinking that it's something natural they will take to avoid the side effect. But in fact, the fungus that is in that extract, this monacolin K, works in exactly the same way as the statin does, meaning it lowers the same enzyme that the statin does.
What do you recommend? Do people take the pharmaceutical type of tablet for the statin or take the fungus, or is it just down to personal choice that somebody makes because they both do the same thing?
I would suggest to just come and see an endocrinologist, book for a consultation to decide what is your risk. But if we have a situation that you're afraid of taking statins because of the side effects, the red rice extract is not for you, because it's got basically the same working mechanism as statins. So it won't prevent you of having those side effects. It's just mentally many think, oh, supplement, it's better than the chemical, right? So basically, I would suggest, before you go the route of taking either the rice extract or the statin, you just need to have a solid consultation with your doctor, preferably endocrinologist, to see what is my risk for cardiovascular disease and what are the goals that we should go by. So meaning how much, so there are different goals of LDL cholesterol depending how high your risk is. So how much it has to be brought down, right? It has to be under 100. Does it has to be under 50? So those are the numbers that we then target depending on your risk.
And if somebody goes on medication for cholesterol, are they on that for life?
So mainly for life. So if you already have high risk for cardiovascular disease, so in example, a diabetic person will go for life on a statin, because we know the studies have proven that that lowers the risk of cardiovascular disease largely. So every diabetic should be on a statin.
So a diabetic person who may not have a cholesterol issue should be on a statin still to control the cholesterol levels, is it?
Yes, yes. Not only to control the cholesterol levels, we know that statins have also another working mechanism that is beneficial for your blood levels and reduces the inflammation that is going on in your blood vessels. And therefore, the studies confirm that those drugs lower your risk for cardiovascular diseases, meaning stroke and myocardial infarction, when you have diabetes, and this is independent of your lipid levels. And if you liked what you just saw, please hit the subscribe button, and bear in mind this is only for educational purposes. And if you need a consultation, please see an endocrinologist, or go on onto our website to get some more information. You will find the details down below. Thank you.
Thank you.